cerebral complications.
The principal area of the brain that is examined with the coordination part of the neurological examination is that of the cerebellum. The cerebellum is incredibly important for motor learning and for the timing of motor activity. The cerebellum is important as far as the timing, the sequencing of the activation of agonist and antagonist muscles across joints and through the extremities as well as the trunk, to be able to create movements that are smooth and goal-directed, to be able to get to a point in a direct, straight fashion. Symptoms or findings of cerebellar dysfunction include decomposition of movement, so the movement is broken into its parts, as well as dysmetria, which is the under and the overshooting of the act. These two elements of decomposition of movement and dysmetria are the two main elements seen in ataxia, which is the major manifestation of cerebellar dysfunction.
What is cerebellum? The cerebellum is involved in the coordination of voluntary motor movement, balance, and equilibrium of and muscle tone. It is located just above the brain stem and toward the back of the brain. Cerebellar injury results in movements that are slow and uncoordinated. Individuals with cerebral lesions tend to sway and stutter when walking.
The cerebellum, part of the hindbrain, is concerned with the regulation of coordination and balance. It is an oval-shaped structure with a central furrow, which is flanked on either side by a bulbous lobe. The furrow is called the vermis, and the expanded lobes are the hemispheres. The surface is covered with folds or folia. In the illustration presented, a section through the folium has been drawn out and cut through to show its internal structure. The outer region of the cerebellum is known as the cortex, or gray matter. It contains two distinct layers of nerve cells. The molecular layer, containing stellate and basket cells, which process information within the cortex, and the granular layer, containing small granule cells and Golgi cells, which sift incoming information. The layers are separated from each other by a layer of Purkinje cells, which carry information concerning body movement out of the cerebellum. Beneath the cortex lies the white matter, which is composed of nerve fibers, mossy fibers, and climbing fibers that pass in and out of the cerebellum.
Signs of cerebellar disease from head to foot. Scanning speech, cause enunciation of individual syllables, the British Parliament becomes the British Parliament. Nystagmus, fast face toward side of cerebellar lesion. Finger to nose, finger to finger test. Ask patient to full extend arm, then touch nose or ask them to touch their nose, then finally extend to touch your finger. You increase the difficulty of this test by adding resistance to the patient's movements or move your finger to different locations. Abnormality of this is called dysmetria, rapid alternate movement.
We are now going to demonstrate the cerebellar exam. The cerebellum can be affected in many of your patients, and you might not recognize that it's affected unless you test. The signs of cerebellar dysfunction from head to foot are scanning speech. So if you ask the patient to say something with many consonants in it, such as the British Constitution, they might say the British Constitution, scanning speech, breaking it out into individual syllables. They might have nystagmus. So if I ask the patient to follow my finger, they would have a nystagmus with the fast phase pointing to the site of disease. I should also say that if they have disease in the vermis and flocculonodular lobe, the patient wouldn't even be able to sit up. They would have truncal ataxia, and you would not even be able to get this far in the testing. Continuing after doing scanning speech, nystagmus, we would now look for dysmetria with the finger-to-nose test. The whole idea here is to try and put as many joints in play as we can. Just count them, 1, 2, 3, 4, 5, 6. As many joints as we can where agonist and antagonist muscles are working together. And the great beauty of the cerebellum is that it's able to coordinate all of this in one smooth motion. And I'm going to now ask the patient to touch his nose as quickly as he can. Back and forth if you don't mind. Excellent. And now touch my finger in your nose. This task, which is not easy, comes about because of an intact cerebellum. Another test that you can do is called the rebound test. It's called the rebound phenomenon or test of Stewart and Holmes. When I ask the patient to pull on my hand if you would, when I let go, if I were to let go suddenly, the hand doesn't go and hit him in the face because the antagonist muscle quickly stops the movement. But in cerebellar disease, that may not happen. So protect the patient by putting a hand across the chest. Pull on my hand, please. One more time. And again, if the patient had cerebellar disease, the hand might go flying up there, and that is why you need to protect them. I'm now going to test for rapid alternating movements. So if you can put one hand out like so, and with your other hand, do this as quickly as you can. Do it on the other side. And this phenomenon, if it's abnormal, is called dysdiadodocokinesia. The next thing we look for is pendular knee jerks. Patients with cerebellar disease might have hypotonia, but it may not be very evident because we're much more tuned to looking for hypertonia than hypotonia. And one manifestation is that when you do the knee reflex, in a patient with cerebellar disease and hypotonia, the leg will keep swinging 3 or 4 or 5 times after you've done the reflex as an indication of their hypotonia. We're now going to step into the hall and do the gait. The cerebellar gait is characterized by a broad stand and by a wide staggering quality to it. People will tend to fall towards the side of their illness, so if the illness is in the cerebellar hemisphere on the left, they might fall in that direction. When asked to stand still, their trunk may sway like this, and that is called titubation. And obviously they would have problems with all the other cerebellar tests. One caveat, many people think of the Romberg test as being a test of cerebellar disease. The Romberg test has nothing to do with the cerebellum. The cerebellar patient is already swaying, and it gets a lot worse when you have them close their eyes. But the Romberg test is really a test of proprioception. When you and I are standing like this with our eyes open, we are getting signals from our joints to tell us where we are in space. If, however, you have a problem with proprioception because of your peripheral nerves or posterior columns, then you're relying on your eyes to tell you where you are in space. And therefore, the moment you ask the patient to stand still and close their eyes, the patient begins to sway. And that is a positive Romberg test. It has very little to do with the cerebellum.
Head to shin test has patients run their head down the contralateral shin. This is equivalent to finger-to-nose test. Abnormal exams occur when they are unable to keep their foot on the shin. Hypotonia. Pendular knee jerk, leg jerk, swinging after knee jerk more than 4 times.
Oula, faut qu'on voit tout ça. Oui. Encore. Bon, c'est pas mal. Encore.
Pros and cons. Pros. Brain-based therapy concentrates on locating the specific pathways which are creating their imbalance. The neurological examinations are designed to locate cerebellar imbalance first and then the cortical imbalance as work continues. By specifically finding the pathways with damage or deficient signals, balance function is restored.
Begin the examination of the motor system by observing the patient's body position at rest and during movement.
I'm going to move these up for a minute.
Also, watch for involuntary movements.
Can I see your hands?
Next, assess muscle characteristics, beginning with muscle bulk. To do
Cons. Ataxia may be caused by infection, injuries, or genetic factors that cause degenerative changes in the central nervous system. Those forms caused by disease or injury are known as sporadic ataxia and are not very common. The more usual forms of ataxia
Apria
are
of mass
hereditary and
isolated
may be
preventive
either
therapy for tuberculosis control.
Of tremor disorder, in addition to rest tremor and postural tremor, is intention action tremor seen with cerebellar disease. In this patient, who has had a traumatic hemorrhage involving one side of his cerebellar white matter pathways, he has a normal function on the right side, but the left side shows significant dysenergia and intention.
disease. Cerebellar disorders have numerous causes, including congenital malformation, hereditary ataxias, and acquired conditions. Symptoms vary with the cause but typically include ataxia, impaired muscle coordination. Diagnosis is clinical and often by imaging and sometimes genetic testing. Treatment is usually supportive unless the cause is acquired and reversible.
I'm now going to briefly show how to assess the cerebellum, or features of a cerebellar syndrome. Once again, I would recommend at all times, you've obviously had a conversation with the patient and you can pick up certain things, but the gait I must emphasize more than anything else. So I've shown on a number of occasions in this video that how to examine a normal gait, but I'm going to talk you through now a person who doesn't obviously have a cerebellar syndrome, but what you're looking for and how to examine it through to its end. So once again, Peter, thank you very much for coming. I'm going to examine your walk and I'm going to talk the students through this as we go along. Okay, so if you wouldn't mind walking as far as the pillar there, turning around slowly, and then halfway back, just stop, okay? And then I want you to walk heel to toe as before. So a bit more slowly this time, if you don't mind, if you could walk towards the pillar, please. So as he walks, I'm looking for the width of the gait. It's called a broad-based gait in cerebellar syndrome, as if someone's drunk too much. And when they turn, they have to turn on an axis like that because they're always fearful they're going to fall over. Now,